Leah is a 42-year-old female. She's been diagnosed with having migraines and she suffered from them for a long time. She's been prescribed Toradol, which is also known as ketorolac. A migraine headache is a severe throbbing pain, usually on one side of the head. It's often accompanied by nausea, vomiting, and sensitivity to light and sound. Most patients that have migraines have an aura as well. Can I get you a napkin? This medication is used to treat acute pain, and it's commonly used postoperatively. I'm just going to give you a little bit of teaching on this drug. Toradol or ketorolac is a non-steroidal anti-inflammatory drug. You seem to be quite concerned about the contraindications and the effects of this drug. The contraindications include gastrointestinal effects, such as risk for ulceration, bleeding, and perforation, hemorrhage, renal effects, impaired renal function, anaphylactic reactions, cardiovascular effects, congestive heart failure and edema, and skin reactions. The common adverse effects include drowsiness and anaphylaxis. Serious adverse effects include GI bleeding, exfoliative dermatitis, Stevens-Johnson syndrome, and toxic epidermal necrolysis. For your weight, you've been prescribed 20 milligrams every time you have a headache, and if it isn't relieved, 4 to 6 hours later, you can take another 10 milligrams. This medication comes in tablet form, injectable solution, or pre-filled syringe.
I've heard you like drinking your ginger tea in the morning, and that can be a concern when taking this drug. Ginger increases the risk for bleeding, and taken with a non-steroidal anti-inflammatory, which also increases your risk for bleeding, isn't a very good mixture, and we advise that you do not take ginger when on this drug.
You're prescribed this medication every time you have a migraine. Make sure you take the right dose and don't take too much. Remember that it may cause drowsiness or dizziness, so try to avoid driving or other activities requiring alertness until you know how this medication reacts to your body. When on this medication, avoid the use of alcohol, aspirin, NSAIDs, acetaminophen, or other over-the-counter medications without consulting your healthcare professional if rash, itching, visual disturbances, tinnitus, which is ringing in the ears, weight gain, edema, black stools, persistent headache, or influenza-like symptoms occur. Leah, I'm going to be giving you this teaching tool, which is 7 things that you should know about Toradol. It's pretty much everything that I mentioned, but just combined into one little piece of paper.